Welcome back. Most Canadians won't need convincing that a COVID vaccine will be worth taking once it arrives. But as you just heard, many Canadians have questions. So to answer some of ours, Dr. Cora Constantinescu, an infectious diseases specialist who works at the Vaccine Hesitancy Clinic at the Alberta Children's Hospital in Calgary. And doctor, I didn't even know a place such as yours even existed. I mean, who gets referred to you exactly?
We have made it into more of a streamlined process and have actually gone out in the physician community and told them that we're here to support them as they refer their patients into us.
And then do you see it as your job to sort of convince people to get vaccinated?
I see it as my job to support people as they're making the decision to vaccinate.
So how does that conversation sound? I mean, where would you even begin?
I start every time reminding myself that at the heart of each and every vaccine hesitancy appointment, there is a parent trying to make the best decision they can for themselves and their family. And it actually takes quite a lot of courage to come in because they're battling a lot of fears and misinformation and overall a lack of trust. So we spend quite a lot of time building rapport and trust with each family, understanding more about them so that we can actually personalize and tailor the communication and the message that we give to them about the vaccinations. And then we work closely with public health where they go ahead and actually administer the vaccine.
And that's striking that you would say that there is this kind of lack of trust. I mean, how would you even begin to advise, I don't know, like a provincial government, a local government, or the federal government to create that or to build that?
Yeah, so I really think that when we think about trust, we have to think at the personal level and at the population level. And at the personal level, it goes back to this idea of putting it into perspective and understanding what the benefit of the vaccine and the danger of the disease is to each of us. So when it comes to COVID, for example, I would encourage every Canadian to think of what this pandemic and what they have done for this pandemic and what this virus has taken away from them. So it might be that some have lost loved ones, others have lost their social interaction, the ability of their kids to go to school. There is a cost to each and every one of us, and therefore there's a benefit to each and every one of us. And then we all have to go and take this vaccine so that we can show that we're indeed in this together. And then when we move at the population level, it's really important to start building this trust. And it's a hard task to take on because you have to consider the complexity of human behavior, especially around COVID-19. And our healthcare institutions can't do this alone.
I don't want this to come across as a callous question, but how do you know what you do works? Because you're not the one administering vaccines, right? Do you track your success rate, so to speak?
So depending on how we look at it, it's anywhere between about 50 to 65% that patients will go ahead and have a vaccine after they've attended our clinic. And in the vaccine hesitancy world, actually that's quite successful.
This has been an interesting conversation, to be sure. Dr. Constantinescu, thank you so much for your time.
It was a real pleasure to be here. Thank you for having me.